Hello, my name is Dr. Anthony Idiaye. I'm a local consultant psychiatrist with the Kent and Medway Partnership Trust. I'm here today to talk to you about postnatal psychosis. This is a psychiatric emergency which, once suspected, needs to be referred urgently to a secondary mental health service. Postnatal psychosis usually can develop within hours to days after a woman delivers her baby. Usually it would develop within 2 weeks. We don't know what causes postnatal psychosis, but what we know is that it can happen in about 1 in 500 women post-delivery. There are certain conditions that can make the postnatal psychosis more likely to develop. This could include a past history of mental health problems like schizophrenia or bipolar affective disorder. With bipolar affective disorder, the chances are that 1 in 2 women post-delivery might develop postnatal psychosis. The symptoms that usually would present with postnatal psychosis could include what we refer to as hallucinations. Hallucinations could be the woman hearing people talk or hearing voices, but cannot explain where that voice is coming from, or other people cannot hear that voice or sound. It could be that she sees things other people cannot see. It could be that she can taste that her food is poisoned, or that people are touching her. These are what is called hallucinations. Other symptoms could be delusions. A delusion is a belief which is not shakeable, which is fixed, and usually out of context to what the society believes. For example, the woman may believe that her baby has got a serious medical condition that needs to be addressed. It could also be that she feels that the baby has been possessed or the baby is very ill. Nevertheless, this belief cannot be easily rationed with this patient, and it could be very distressing to her and for her. Other symptoms that could also present could be the woman feeling low or feeling too happy, what we call hypomania or mania. In this context, we are thinking about has she got bipolar affective disorder if she presents this way. Other women may also present with anxiety because they are quite worried about what's going on and they just cannot relax and they feel very anxious and restless. The woman may also present with poor sleep. If this were to happen, they are quite difficult for the patient and may present significant risk to the mother and to her baby, and to a larger extent can affect the entire family. Once this is recognized, once the symptoms are noticed, a woman can be referred to the secondary mental health service, depending on the location where she is at the point in time. If she was to be in a hospital, in the maternity suite, the maternity staff could refer her to the psychiatric liaison team, who usually work 24 hours of a day, 7 days a week, and are quite responsive to referrals. If this one was seen by a doctor in the community, she could be referred to the secondary mental health service, specialty service, such as the perinatal service, local to where she lives. The service are usually very responsive and will pick it up because it's an urgent referral and an urgent case that needs to be addressed. Postnatal psychosis can be effectively treated. They could be treated by use of medication, use of talking therapy, and supportive therapy. Let's talk about medication. The medication we usually would use would be what we refer to as antipsychotics or mood stabilizers. They are quite effective with very minimal side effects, if any side effects at all, although some of them can come up in the breast milk, but the amount that comes up in the breast milk is quite tiny that the woman might be able to breastfeed depending on what medication she is placed on. Talking therapy. There are very effective talking therapy that could also be used, but these are usually employed when the woman is a little bit more settled and also able to participate in this therapy. Supportive therapy could be, her head visitor getting more involved and other professionals just supporting her through this very difficult period. In very rare cases, but we do see this happen, she may need to be admitted to a mother and infant mental health service, what we call the Mother and Baby Unit, MBU. These are national services which are scattered all around the country. The take-home message from my presentation today is, please, if you suspect postnatal psychosis, refer urgently to the secondary mental health services. Thank you.